Okay, so do we need to call the meeting to order then? We don't have a full group here yet this morning. Let me see who we have. It's 10:08. Do we want to wait any longer or go ahead and call the meeting to order?
Let's see. So we're missing Baron.
Is that it? Yeah.
Yeah.
All right. Then. Okay. Well, we'll go ahead then with the roll call.
I can do that. Let me pull that up real quick. So is Trey Addison is here?
Trey's here.
Greg Sini is here. Bonnie Berman?
Here. I'm here.
Lori Stebick-Rust?
Here.
Jennifer Drost?
Here.
And Tina Hotchwald?
Here.
And Baron Mahajan? Not present. Got it. And then also we should probably just approve the meeting minutes. I had sent those out at about 9:55, and prior to that I had sent them out to the team to review. So I was just wondering if anybody wanted to make any changes on the meeting minutes. If so, let me know what that would be. If you're good with that, I would need somebody to approve that and it's second.
I'll make a motion to approve.
A second.
Okay, wonderful. And outside of that, I will be taking notes again today and sending out meeting minutes and all that kind of stuff. So I'll just track them. It seemed to work last time, so we'll just keep in that same format. Trey, do you want to kick things off and lead like you did last time? And I would say if you start talking about a document, it's probably very good if we share that document on screen. So there's a share button and you can just go to that document and then we can all be looking at the same document as we're talking through it.
Yep, I agree. And then I guess just to pick up where we left off, Lori, I'll hand it over to you and you can kind of walk us through your document if you don't mind sharing that, or I can share it, however you would want me to do it. But I think that that's probably a good starting point. I also sent out a document this morning. Basically, it's just a landscape of where other states have been via task force and what they've done, what they haven't done, and where kind of Ohio would be. So that being said, Lori, I'll kick it to you and you can kind of walk us through the sort of the document that kind of organizes this from our work.
Okay, and you know what, Trey, if you have the document open, if you could, let me just see if I can pull that up real quickly here. And then I'll just share that to the. Sorry, there we go. It just formatted straight. So let me do a screen share on that. I'm working on getting the screen share here. Why is that not open for you guys? You can't see the document yet, can you?
I can share that. Oh, you
know
got
what?
it? Okay.
Can you guys see it? I just pulled it up.
Yeah.
All
I
right,
was
perfect.
going to say on mine, it's looking for permission. I don't usually use Teams very often. It wants me to reset my program here. So, Trey, it's the first one actually that has the summary. If you go back to the first page.
Got it.
No, that was it. You just needed to scroll up.
Oh, shucks. Okay. Redoing it.
All of the important things. Once we get past this, the rest of our
Logistics.
Right.
You see why it takes three of us to sort of navigate?
Yeah, right. See?
There we go.
Right.
All right.
There we go. So again, as I started to say before, this is just my first pass at trying to take a look at how to take the largest of the work and the scope and put it into something workable for each of our weekly meetings. or our Monday morning meetings. I'm certainly open if others have ideas that say this is not really the format that makes sense to them. But what I did is I took the committee descriptions and looked at the identifiable tasks that we are tasked with completing for the larger report. And I broke that down into 4 primary categories, which are big in and of themselves, but identifying new and best practices to support early detection and progressive interventions. Again, we can even break this down further because early detection and progressive interventions are their own separate categories, but I think they're under the same heading. And then to examine the methods to position Ohio to harness both the science and integrate it into practice was another summary of 3 of the bullet items. And then third was to identify the gaps in the current state of interventions, both for healthcare on the acute care side and long-term care settings to successfully implement the strategies that we come up with. And then finally, pull this down. Oops. And then finally, to look at the analysis of the strategic action plan on aging related to dementia care and caregivers and health systems needs all combined. For me, I feel like that should be the tail end of this. If we build the framework and the structure of the first 3, then we're really dovetailing it into that strategic action plan, which is really the largest of aging, but how do we then delineate dementia as part of that aging journey? And to me, that feels like the ending portion of the work that we are going to do, and then to make that more structured specifically for dementia care. And then within that, Trey, if you scroll down a little bit further, was to maybe take a look at how we break this down specifically, like the goal of each of these 4 categories, and then it ties to our mission. So the goal is to identify new and best practices to support early detection, early interventions, and the vision then is that Ohio would be the place will be #1 in the nation for progressive dementia care. That's some of the language that's tied into the strategic action plan for aging. So we're working along a very similar structure. And then further, we can break it down. Again, this was just me kind of populating a rough draft, just throwing some concepts in there, but looking at what factors impact early detection, and then how do we address that? So, and then how will we know if we're moving the needle? So for example, if one of the factors is better training, better primary care screening, one of the indicators to know if we're moving the needle would be we should begin to see more early diagnosis of the disease upstream. We should be able to see more diagnoses of MCI. So again, just kind of using this framework of how will we know if we're actually moving the needle on any one of these specific categories. And then within each of those areas, we can take a look at the diamond topics that were identified for us and that we added to our list to see where each of those elements fit into this structure, so we can start breaking apart whether we do it through a SWOT analysis. So let me pause for a moment and get a sense of, before we move any further into this, if this is a structure that you think makes sense, if any of you have a different way of envisioning how we get to our end goal.
I like the idea of breaking it down, simplifying it a little bit. You know, obviously it's daunting to look at all those diamonds and think, okay, how do we come up with something? So breaking it into 4 areas of focus and then working on those, I think. I'm interested to hear how we would work in between meetings to be able to respond to some of these areas. What are your thoughts on that?
You know, so again, this is just maybe how, when I think of a SWOT analysis, it's really about a project, it's about moving something specifically forward. So for me, and maybe you guys will be able to enlighten me on a different way with that, I couldn't see how a SWOT analysis fit for me in this, because there's so many unknowns. It's not like it's our entity we're creating, we're building a paradigm. Now, in between, Greg, I think that if we start to look at what are the elements in the diamond area or the diamond topics, how do they fit into each of these subcategories? So for example, looking at, let's see, our very first one here is the type, cost, and availability of dementia care services is one of our diamond areas. And so I could see us in between maybe dividing these categories, maybe 2 or 3 of us taking each one of those 4 elements. Well, actually, I would say, maybe I would even back up and say, let's just work maybe on the first 3 and save the strategic action plan as kind of maybe something we work together as a group after we've built our own model to tie into the state's plan. That maybe we take those top 3, and we divide ourselves, again, smaller within the group to work on how we identify, let's say, for example, new and best practices. Part of that's going to be involved with our diamond area of public awareness. Some of it's going to be identified with cost. And then we get granular within each of those diamonds, I think is a way to kind of begin to organize the data.
Hey, Lori, I think, one thing that it kind of stands out to me is there's probably, I agree to look at a lot of the diamonds. It does seem, quite overwhelming, but to break it down in this way, it's helpful. I even think in looking at where we don't have to reinvent the wheel, there may already be items that we can plug in here and then identify it as potential, a potential area to focus on. There may have been successes in some other states, and you just we can leverage that as a solution if we want to present solutions to the broader group. But I like the framework, just how my mind thinks on this, because it does seem over. It's a lot of diamonds, and even when in sharing it with my team and even our national team after the task force meeting, it was like, it's a lot of stuff. So how do we break it down and then go deep on the areas where we've had success across the country? I'm sure there's many programs where we've seen success. So I think this is helpful to me, at least, but curious to hear from others.
So this is Bonnie. Could I weigh in for a second?
Absolutely.
So my question is actually for, I don't know so I'll just identify Trey on this one. And that is when Greg said, well, what would we do between meetings? If we came up with thoughts, could we ask whoever is going to get that contract to do a little of the research for us in between? I guess I'm not sure how that group would interact with us.
Bonnie, that is a phenomenal question. And
thank you.
There has not been any indication, at least to me, of that particular group or how that group will intersect with our work. My hope is what you just alluded to, that they can do some of the digging. Obviously, from an association standpoint in Alzheimer's, it's like, we can present a whole lot of information and data, but is it on the task force committee members to break down and analyze all of that information and then come up with the plan? I just don't think that would probably be the best use of all of our time, as opposed to working with that particular group to help us build frameworks. So that's a great question. I think, one of the items we can probably propose that back to Julie and team just to see where they're at in that process. I know they said they wanted to move very fast, but I have not heard anything from the RFP standpoint or process as to when that group will intersect or how they will intersect in our work. So very good question, and I can follow up with Julie on that.
Thank you for that.
I can speak to that a tiny bit for you. Very close to the RFP going out, so it is being fast tracked to identify a contractor. I will say that my understanding of their role is to support the work of the group. So I don't know if that means actually doing research. I think what it means is helping you compile and coordinate and communicate and document. I don't know if it includes actually doing the research. So my understanding is their role is to support the work of the committee. So there may be some leeway in there about what that means, but I suspect that's more along the lines of making sure you're doing meeting the goals you've set forth for yourself, and documenting, sharing, coordinating with the other committees, helping with all of that work is my understanding so far.
Thank you. That actually does help. And I think for me, that's why when I look at the putting this together in a structure of the work that we would do in between now and then, Bonnie. When I think about that, it's how would we even know what to ask for or who to reach out to if we don't know exactly still where our holes are. So for example, if we started to look, I'm focusing still on the first one as an example, but identifying new and best practices to support early detection. If we have people breaking this down and going, okay, here's the strengths in the area that we know, here's where we really need somebody to help support and fill in the holes of that data. You know, what's out there, where are we at? So then we can be specific in our ask of maybe it's organizations that that are sitting on all this data that we just have to pull together. But for me, I wouldn't even know who to reach out to yet, since we don't have a structure of what we're even asking for.
So Hillary, this is Bonnie again. If the RFP hasn't gone out yet, it sounds as if at least this committee is thinking about using that group in a even more direct way than you just identified, because what Lori said was, gosh, we can't figure this all out in 2 weeks, but maybe they could.
And I'll share that with Julie. I'm sure she can provide more specific direction about their role, but I think you're right that they're getting a later start than you. So again, probably not going to be a great resource for doing actual research, but more in compiling, communicating, analyzing, that kind of thing.
Okay.
Does anybody else have thoughts on the framework? Again, things that you might want change, things that don't fit for you, that if you think that's not how I would organize data. Thoughts around the let's just call it the 3 pillars, excluding the 4th till the end.
Hey, Lori, this is Bonnie again, and I just, I promised everyone I'd be quiet. I'm not doing that.
Quiet, Bonnie.
Is the document that Trey sent around, and I guess I have not had a chance to read it, but he focuses a little bit on the policies that it would take for each of the things that you mentioned to happen. And I'm wondering if there isn't a 3rd column of the policy needs.
So are you suggesting, Bonnie, I haven't seen Trey's, I didn't get to my email before the meeting, but are you suggesting that where we have the goal, in between the goal and the vision, or that underneath the goal, like what factors would impact that we just add? I mean, again, because these are not exhaustive. This was just me trying to put a draft together.
So let's see, what factors impact the early detection of Ohioans? Mm-hmm. What policies are, needed to make that happen? Mm-hmm. And then, evaluation, et cetera. But I don't know if that's this committee's work at all, but
yeah, I do know that there's
how
a
you
policy.
go from this would work to how do we know it worked?
Yeah, and maybe policy is one of the factors. When again, looking at the way the document here is at least proposed, is if we're identifying new and best practices, part of that is identifying what policies interfere with that or are not in place.
You're right.
But then also, just even having the policy in place doesn't help us more granularly affect primary care screening, which is another critical element. So for me, I see policy not as a separate column across the top, but more like one of the factors that's going to influence that and then lead to how will we know it's better. So if the policy is in place, how would we know if we've made a difference would be, that the policy is being implemented, for example, and that would be over in the column of how we can track it.
Yeah.
But no question, I absolutely think that policy is one of the subcategories underneath the things that we need to include.
Yeah, I think the document that I sent out primarily, I mean, and it focused on, I would say, public policy that can be moved or can act as a solution to part of the issues, especially around early detection, prevention, so on and so forth. I think the other component of that is actually programmatic policy, meaning that, to get to a solution, you have, for example, I think I mentioned in the memo, Project Echo, which is something that some states have had success around. How are we leveraging that as a potential recommendation if we're comfortable with the findings that we find from other states' successes. So I think it may make sense to add it in there. I know there is I think every committee that's on the task force, I think, will likely come out with some sort of a public policy solution and a programmatic solution. I think we probably want to do the same because it'll position us for actionable steps as opposed to, and how do we measure the work of our committee? Like, is this what is the actionable step that we proposed that we can see come to fruition? Because our intention, I believe, as an association would be to advocate for those action steps because they align directly with impacting people with Alzheimer's and dementia. So I think that's the thing as we look at it, is utilizing those action steps that come out of our committee and any other committee as actionable items to act on and move along in the process. So again, sorry for sending that doc out so late, but I would say it fits in, I think, quite well here.
Yes, it
because in
does.
some of the areas we can just plug in and here's a solution for some of that. And how do we study that as a committee and research it? So, and there is links in the document so you can see how other states interact and what other states have done. And again, successes in some states, there wasn't a whole lot of success. So I think the document that I sent complements your document, Lori, is what I'm saying.
Trey, why don't you share your document?
Okay, we'll do. Give
Just
me
real
one
quick.
I'm sorry. I mean, when you look at the three categories, public policy and programmatic policy, Trey, as you mentioned, would certainly be areas to be broken down probably within all three of these primary overarching goals. And then the measurable, how do we know if we've impacted might be whether a policy's been implemented, whether we've come up with a way to actually utilize, because we know there are a lot of policies out there that are just not being utilized, and places where there's never been a policy created. So Bonnie, again, I think it's a great suggestion, and it will be one of the things that we maybe continue to add to populate under each of the categories.
Yeah. So Lori, an example that I would give with this is that if, and again, I don't have the figures, the Alzheimer's Association does, if only about 40% of people who have dementia have a diagnosis,
right,
then that fits so well with what you're saying. But the question becomes, do we teach it in medical school? How do we know that it's not just not getting it? Maybe they don't give it, so it's those kind of programmatic and policy changes that I was thinking about. So thank you for that.
Exactly. And I think that's why when I just took, again, a quick pass at adding, because I certainly knew that this team has a lot of knowledge that will be able to populate this much better. I just really wanted to take a stab at trying to help us get things organized and get started.
Yep.
I think you're 100% correct. And that's why, for me as a clinician, when I look at primary care screening, that's a huge area. I mean, people should never be coming into clinics where they are just given a generic diagnosis and then no follow-up, or not given a diagnosis at all. So we know that that is a huge starting place in all of this process. So, so it sounds to me like, at least for the bulk of the group, the structure of this makes sense.
Lori,
Yes.
I really like the structure. I think it looks great.
Thank you. Thank you. Who said that?
So I think that we should take a vote on it, make sure that everybody's good with it. So we need somebody to approve Lori's document. I think we're going to add policy to that, both public and programmatic.
Well, let me pause you, Craig. Let me pause you, though. I would like to make sure that we make a recommendation just on the structure, because beyond adding policy, there's going to be many other things that each person's going to group in here. So I don't want the motion to mean we have to include public policy and programmatic policy.
Right.
I think that will be for each of us.
The basic structure of it.
Yeah.
Yeah, I think the basic structure makes sense. I think it helps us organize the work. So I would put a motion to essentially recommend that the structure is fine.
Yeah.
And I will second it. This is Bonnie.
Okay.
So then the next steps, I guess, really will be for us. Let's see, we're here at the 10:30 hour. If we take a look at, do we as a group agree with the notion of focusing on the top three, holding on the fourth until we build a structure to add into that? So I guess that's the first question. Does that make sense to everybody?
It does. I think you have to have the first three to move the fourth forward.
Yeah. And so then if we look at our subcommittee moving forward, then for us to break this down in between now and our next meeting would be to have, maybe one or two people decide which of those three areas they feel like they have the most experience or expertise to maybe take a quick pass at working on the document, either their own or it could be shared with another member of the team, so that we're not duplicating. But that would be my suggestion, is being able to jumpstart this.
Yeah, so we have 6 people on the call right now, so we could just divide it in twos. So if you want to grab it while you can, because you're comfortable with it, otherwise you're going to be assigned to it.
Yeah.
Well, this is Bonnie. I'll go with the primary care. Which three are we? We're choosing from these three that are up here now?
Yes.
Yeah, can you put that back up, Trey, if you could slide up?
Are we?
There we go.
Yeah,
So
these top
holding off
3
on
are what we're going to divide and conquer right now.
Yeah, we're going to hold off on the analysis of the strategic action plan on aging until we've got more structure around the first 3.
I'll take a stab at the first one because I can pull up the document, but you'll see where the cross section with number 1 kind of complements the document that I sent out this morning.
And Trey, I'll work with you on that first one.
Okay. So Trey and Lori are on the first. Anybody want to jump on something?
I'll do any of them. Anyone that no one wants to take, I'll do.
Methods.
I guess I would, this is Jen, look at the third one, identifying gaps in the current state of intervention. And our goal, like between now and next week, is to kind of model and flush out page 2.
Exactly. Yeah. And again, feel free to, like I said, this is really just a rough skeleton. Certainly be adding, and healthy living may or may not fit. I was just really trying to just, for today's call, put something in there. So if you remove things, you add things, that list can be 6 or 7 deep, knowing that in the end, for each of them, we're trying to accomplish what's our measurable. How will we know if we've moved the needle? So Jen, you're on identifying gaps.
And this is Bonnie. I'll work with Jen on that.
Okay. So Bonnie, you're on the third, identifying gaps, and Jen is on the third. Tina and I will be on the second, Greg Cini, and then Lori and Trey are on the first, identifying new and best practices.
And then I guess we're going to have to find out about our member who wasn't here last week or this week.
Yeah, she said she was going to struggle. I think it's a she, to be on the calls at 10 a.m., but would actually, if we wanted to assign work, we could do that. It's hard not being on the call to sort of get up to speed. So I don't know.
I can reach out offline and just find out what we need to do, because I agree with you. I think to just assign work blindly out of this
not going to work.
Our meetings is not going to be very useful. So, okay.
I think we're okay for this meeting because we pretty much have it equally divided.
Yeah.
And so if you could reach out and then just let me know, that would be great.
I will. Okay. And then my only final piece on that in terms of the structuring is the going forward plan then is, once we have that built, we'll then start looking at the strategic action plan. It might be helpful for those of you who maybe didn't download this off of the site. I really tried to mirror some of the work the way that document is worded. So we're not going, oh, here's our document, how do we dovetail with the different scope of work that they're doing? So it might be helpful for you to take a look at that document as you start to build some ideas around these 3 core elements. And again, if as you go through it, you think, you know what, one of these really should be broken down even further, that's please know I really did just try to grab the largest and put it into a usable document, but it's a fluid document, and definitely want to hear from each of you guys as we continue to build it. So.
What are we calling these 4 sections? Are they topics, or what do we want to
I
call
had them
them?
listed as goals.
Goals.
Again,
Okay.
because, and that I think came off of the document there. Those are the goals, and then the goals
Okay.
feed into the vision, and underneath
Yeah.
the goals are the factors, and then the measurable of how we know we're moving the needle. So
Factors, and then
the goals, the vision, the factors, and then the identifiable benchmarks, if you will.
benchmark. Okay. Sounds good.
Anybody have any other thoughts about that for this morning?
No.
Would it be
good
useful?
work.
Thank you. Would it be useful to put this in a workable, shareable Google document that as we're working through it, just because we've divided up doesn't mean that something brilliant might come to us that we want to plug into make a suggestion in somebody else's, that maybe if I put it in a shared Google document and send it out, and then we can start populating that way. Would that be useful?
I
I
think
like
so.
that idea, Lori.
Okay, great. And then within that, I think, and again, if anybody wants to make a pitch for the SWOT analysis, I didn't mean to negate that. It just, in my brain, I could not figure out how we were going to spend time this morning doing the SWOT analysis on this. But I don't want to say that that gets thrown completely out, because one of the struggles I think we're going to find is where we started before, which is we need more resources. Who's going to help us garner the data? And when we break this down, that might be one of our obstacles that we add underneath, that then we can start reaching out and saying, okay, who can help us? I can't spend 13 hours a day mining the data. But so I do think in that sense that component of the SWOT analysis that is outside of our internal committee could be useful in driving in the data. If we identify that as an obstacle, just manpower and resources. And Trey, I know you have access to other states' best practices in your document, and that will be very helpful, I think. But we'll get back to who's going to help us mine that data. So.
Yep. No, absolutely. And I think, I think it'll be helpful in that shared document. I can easily plug and play kind of what fits where.
Yeah.
In from other states' perspective. So
okay.
Absolutely. And just I think this is a good way to work, and super helpful to me at least.
Great. Well, then you can look for me to hopefully get to that and get that out to you. I'm going to commit to maybe by the end of the week, I'll get all of that structured. Again, I only put the first one in there, but if we're all in agreement that I'll at least plug the next 2 into the same kind of a framework, and then it'll be a workable document.
Sounds good.
All right. Is there anything else this morning that was a hot burning topic or ideas on here, or anything about our next steps?
I can pull up the doc I sent briefly just to walk through it. That way, I think it'd be great for you guys to take a look post meeting, but I can just kind of walk you through kind of what's in it and the why and what's behind it. If that would be helpful for everybody as they kind of get a chance to look at it during the week. Give me 1 second, I'm pulling it up now.
Jen, your environment looks a little bit different than it did the other week. Your background.
Yeah, I was
I think it was
on
a
vacation
bunk
enjoying
bed
a
last week.
tiny house cabin in Virginia. So
Yeah.
All right. Can everybody see the document? I'm sorry about that. It was on mute.
Yes.
All right. Perfect. So yeah, like I said, I shared this with the Department of Aging in a different iteration, but sort of with similar frameworks and really with similar landscape of just kind of where things are at from another state standpoint, looking at programmatic as well as policy solutions that we could look at. As you can see in the first, kind of three major buckets that we kind of see the work in or the state plan in, early detection, diagnosis, diversity, inclusion, and health equity, and then long-term care. The long-term care component is more of a programmatic in future casting where things could potentially go from that standpoint. But the first number one and number two are key targets and key areas. Number one, that are focuses of the governor and ODA and the Department of Health. But of course, looking at some of our new data around diversity and inclusion, specifically around health equity as it relates to primary care physicians. I'll share some research with the group as well as the broader task force that kind of zeroes in on that. But you'll see in the research and the data, it's quite alarming just the disparity within health equity, dementia, Alzheimer's, et cetera, but also, adding the layer of diversity and inclusion element is pretty interesting. And then also the early detection and diagnosis component. Specific programmatic opportunities supported corresponding with policy solutions. You'll see here, and this coincides with public policy positions that other states have done. But, Project ECHO, looking at physician education, which kind of came up here a couple times already, improving care coordination through Medicaid, requiring hospitals to develop dementia-specific operational plans, building on statewide infrastructure that supports detection, diagnosis, et cetera, also addressing systematic changes in long-term care, really updating the regs that are currently on the books, training and licensing. Culturally component public awareness campaign, mainly that falls with what I would say ODH as a whole. But when you look at some of those 7 items, I would recommend taking a look at some of the links. Virginia has been probably one of the more progressive states as it relates to getting in front of the issue from a policy and programmatic standpoint. They've done a significant amount of work on both sides. Our team there has been instrumental in that process, but really looking at it from the sort of the two-headed monster of programmatic policy. How do the two complement each other to progress the state? Florida's done a decent amount of work, especially around Project ECHO. Is everybody familiar with Project ECHO just at a baseline? If not, I can send out some information following this meeting.
I am not familiar with it.
Okay. I'll send out information on that as soon as we get done to complement this document. So they've done some work around their Project Vital. That's more of a programmatic stance. Their governor in Florida, as well as sort of their Health and Human Services director, had all kind of come together and done a lot of great work around it. Georgia has actually done some work as well from a policy standpoint, specifically around long-term care, looking at direct care staff, looking at memory centers and how they sort of regulate the training around that, which was surprising for us as we work with our Georgia colleagues, just to kind of see how that works, especially in Georgia, and for Georgia to be more progressive as it relates to training and putting together specialized dementia training was huge for us, because as we've seen, even with current legislation that we're working on, House Bill 23, first responder training, states that have done that prior to Ohio, it just lays the groundwork, especially like states, from just a context of, same areas, demographics, so on and so forth. Missouri has also done some work around family caregivers, and they've looked at really in-home family caregiver as well as agency. Massachusetts is another state that's done a good amount of work. I think, Massachusetts has kind of done a good amount of work for the last number of years, but specifically over the last really 2 to 3 to 4 years, they've really been progressive on the legislative side to truly complement sort of the programmatic side in education as it relates to physicians, which is what, based off the data that we'll be sharing with the broader task force and this group, you'll see kind of the sort of the issue as not even issue, but the breakdown as it relates to physician education and really programs around that. California, of course, has been quite progressive around the issues, especially as it relates to cognitive toolkits for Alzheimer's. One of the things that I would recommend is taking a look at the clinical care guidelines for California. The association did a lot of work around that. So I think that'd be helpful for the group. And then Wisconsin, my colleague Michael in Wisconsin, him and I probably talk, every other week just to try to get a grasp on some of the work they've done, especially around grants. I think they've been able to deploy and work with the state to deploy Alzheimer's awareness grants that they're really competitive, and they're slated to see these numbers increase. This is also sort of a complement of programmatic and policy, where the policy assisted with the facilitation of the grant, but then they're really focusing it on underserved rural and urban populations, which has been huge and a huge success actually for Wisconsin and the work that they do. So again, I think, if everybody had a chance to look at it, you can kind of see going back up to this area, 1, 2, and 3, early detection and diagnosis, diversity, inclusion, health equity, and long-term care, how sort of some of the programmatic work, these top 7 items really complement the work of this particular committee, but also kind of adds in another layer that I think was not one of the diamonds that should probably fall in our purview, but even at the same time, we're not even included in any diamonds from what our analysis says, based off of what this general scope of work is. So, like I said, definitely, would love to take any questions on it and really just ask that everybody takes a look, because I do think it complements Lori's document as well as the broader work as we think about solutions and actions that come out of the committee.
Yes, wow, thank you, Trey. I do think that will be a very helpful overlap and help us identify what's still missing. Where are we going to go without recreating a wheel, and then what's still missing for our ask. So this is great. Thank you.
Thanks, Lori. Any other questions on this doc before I close it down? And again, it should be in all you guys' mailbox. I'll send out some complementing data. Like I said, once my team sends it over to me, that's kind of compressed and specific to our issues.
So Trey, this is Bonnie, and I do have a question. This is more procedural for Lori and Greg. For example, as I read this, there's a couple of areas where we as a group should have more information, and the information is out there, we just don't have it. To whom do we send those requests? So as an example, as you know, Trey, a few years ago, the legislature in Ohio was supposed to develop guidelines, measurement, all of the things that was in one of the categories in one of the states for memory care units.
Yep.
And that was a Department of Aging and Department of Health initiative through the legislature, and so House Bill 470. That should inform this, but I don't know how we get it.
That's a great question, Bonnie. And this, I guess, from a structural perspective, I think having the Google shared document that we can start putting in, here's what we need, here's what we think we need access to, and then maybe the team can weigh in terms of who has access or who can get that for us.
That'd be great. Thank you.
Yes, very good question, Bonnie. And 470 will definitely, I have not seen a whole lot from that, so I think that would definitely be helpful. Well, if anyone has questions for me on this particular document, feel free to reach out. But again, I think it's helpful, and we'll complement the data that we have and send that out. But again, I agree with Bonnie. I think there's other areas where we can probably dig and get some more information. So, thank you.
Yeah. Well, it's 10:53 right now. We have about 7 minutes to wrap up. Is there anything else that we need to focus on? I would say the next step for all of us is to get with your partner and get on their schedule so that you can move things forward. You know, next Monday is going to come quick for all of us. And so have your homework done.
And I will really commit to trying to get this, since we are meeting again next Monday, sooner than Friday, to get the Google Share document up there. Again, it will be, look for it soon. And then actually, after this meeting, Trey, if you and Greg have a few minutes, we can jump on a separate call. That would be helpful.
Sure.
Not a problem.
Hillary, so I send the meeting minutes to you, or I think it was Tally, or not Tally, but Tessie.
What's your normal process? You're welcome to send them to me.
I think that's what it
my
is.
notes as well.
I think that's what it is. I just would imagine between each meeting, I'm sending meeting minutes to them.
Okay.
Okay.
All right.
Well, good deal. So thank you all, and we'll get to work on this and see where we end up next Monday and go from there. If you have any questions on connection or anything like that, you can always reach out to me.
All right. Thanks, everybody.
Great. Thank you all.
Thank you.
Bye.
Bye.
Greg and Trey, would you like me to just do a quick FaceTime, or can I just send out a quick meeting minute here and we'll just jump on a separate call?
You're able to stay on this because it was scheduled for an hour and a half, I think.
Can you stop the recording then? I'm better
Sarah?
off. I'll tell you what, I think it's easier. Let me just send them a separate Zoom link. We'll log off here and make your life simpler. Great. Thanks for the reminder. Okay, thank you.
Thank you all. I'll talk to you soon, Lori.
Okay.